Hello everyone, this is group number 1. We are going to present about the mental health.
Four major elements of the community. History of South Parkdale. South Parkdale is a southern section of village of Parkdale, annexed by Toronto in 1889 and its 10th year after its official incorporation. In late 1900, the neighborhood grew rapidly as one of Toronto's first commuter suburbs, spurred by the development of railway and later streetcars. Moreover, streets are laid out to allow access south to Lake Ontario and north to Queen Street, which is the main thoroughfare of commerce and trade. Additionally, in early 20th century, local historians were interested to work and showcase the beauty of this community. Moreover, in early days, large homes and spacious grounds overlooking the bay with their owners' boats moored at the jetties characterized the scene, while comfortable dwellings on large lots began to fill up with the spaces up to Queen Street was on the rise. Within a few years, the lofty arches of healthy trees added beauty and shade to the avenue that commuters from the new suburb were able to board trains for their daily travel. Furthermore, in year 1922, Sunnyside Amusement Park and Bathing Pavilion launched as Toronto's version of Coney Island that made South Parkdale to be known informally as Village by the Lake, with a mixed housing stock consisting of fine Victorian and Edwardian terraces, some substantial mansions, and large apartment houses in their neighborhoods that contained one-third of all Toronto's apartment houses by 1915. It is a multicultural area. People from various cultures and countries reside here and hence make it rich in its culture. As people from many cultures reside here, various countries and culture live here, they have different values and beliefs. They have merged with each other and have created a very diversified atmosphere. Demographically, City of Toronto describes South Parkdale that 21,849 people are living in the community from 2011 to 2016. The greatest number of people in the community are working age while children are less. The population in the community is not homogeneous, rather diversified by Canadian citizens, immigrants, non-immigrants, Aboriginal identity, and visible minority population. If we focus on the demographic data, we find that its population is 21,849 and about 41% of population in the neighborhood did not have English as their mother tongue. Over 35% of the people have bachelor's degree. 11,390 people own a private household. Majority of the population lives in rented houses. Hold that is 86.8%, and their median home income is 41,761. Local statistics. Over the course of the lifetime, rates of substance use disorders were higher than the rates of mood disorders. About 6 million Canadians met the criteria for substance use disorder, while 3.5 million met the criteria for mood disorder. Rates of mood disorder are highest among youth aged 15 to 30 compared to other age groups. Young women in particular have the highest rate, that is 12%. Approximately 60% of the youth who have experienced mood disorder have also had suicidal thoughts in their lifetime. Suicide is the second leading cause of death among young aged 15 to 29. Approximately half 53% of the youth with depression or suicidal thoughts have sought professional support. Legislation and subsidies. The federal government produces currencies, regulates taxes, establishes federal welfare program and foreign policies. It oversees the defense of the country and makes them operate in such a way that it affects the nation as a whole. The federal government ensures cooperation of state and local governments by providing funds to federal programs such as affordable health insurance, building roads, airports, highway systems, and pollution control.
Definition of terms. Canadian Community as Partner Model is a tool used by community health nurses to build the capacity of community members to participate in all actively and collaboratively take action in achieving goals set for the community and its residents. Community normal line of defense. The outer sold line surrounding the community core, while its subsystems represent the community's normal line of defense or the community's level of health. Determinants of health condition that contribute to disease and disability. Flexible line of defense is a buffer zone that represents a dynamic level of health from a temporary response to treats. It prevents temporary and transit stresses from penetrating through the normal line of defense to either the community subsystems or the core itself. Line of resistance are relatively permanent factors and mechanisms within each of the systems that act to defend against threats such as risk factors penetrating to the community core. Also considered as a protective actors, the strength and assist of the community. It exists however each of the subsystems and their strength influences the degree of reaction to a stressor experienced by community or population aggregate. Population normal line of defense is the collective health status of the people at a point in time. Primary prevention focuses on risk factors and health promotion, health education and awareness program that forces social justice, reduce inequalities and encourage healthy lifestyles are examples of primary prevention interventions. Primordial prevention is the furthest upstream and is in the domain of public health. It seeks the root causes of the stresses, risk factors, and treats to the health of populations and asks why these exist in total society. Secondary prevention is used for a stressor has penetrating the community substance systems. The focus is on treating response to stressors and emphasizes early case finding, symptom management, and correction of maladaptive responses.
Health Promotion Framework, Canadian Community as Partner Model. According to Volman et al., 2017, the intent of the action phases of the CCAP model is to build the capacity of community members to participate in all aspects to act collectively and collaboratively in achieving desired outcomes for the community and the people living in it. The core of the assessment wheel represents the people who make up the community. The core of the community are the population's social demographics, like age, gender, and ethnic distribution, culture, education achievement, and socioeconomic status. Next is its values, beliefs, and history, as well as information about the population's health indicators, such as mortality and morbidity. The CCAP process should engage the community, involve its members, and be driven by the issues as viewed by the community itself. Case scenario. A 26-year-old male attends your community health clinic seeking care for an ulcer on his foot at an injection site. He struggles with addiction and homelessness. There are 3 assessment methods. First is the windshield survey. Windshield survey was done through observation and variety of senses that captured the essence of determining areas for further investigation and sense the tone of the community. Some group members went around the neighborhood of South Park, while the rest used social media platforms to collaboratively work with the community assessment. According to the College of Nurses of Ontario in 2020, understanding the nurse-client relationship is important as it affects one's well-being, participation, and compliance with the nursing care plan. This aspect of trust, which is defined to be critical in the therapeutic relationship, as it is not easily gained and continuous effort is a must to maintain it. The second one will be building trusting relationship. According to Matthias and Pullen in 2010, there are 5 ways to gain a client. First, introduce yourself and your role while addressing the client with his or her name. Second, provide privacy for every nursing intervention and be sure that her basic needs are met, such as relieving pain or other sources of discomfort. Third, listen actively to your client. This can be observed by restating what he says. Fourth, maintain eye contact at appropriate times and length to prevent coming up to be intimidating. Smile at intervals and nod head to show engagement in the conversation. Last is maintain professional boundaries by being respectful in all aspects, prevent making assumptions. And lastly, for the assessment method will be Canadian Community as Partner Model.
The community environment is divided into several subsystems such as physical environment, education, safety and transportation, politics and government, health and social services, communication, business and economics, recreation and leisure. These subsystems are the building blocks of the society wherein people in the community interact, oftentimes affected by, that in turn influence this into more sustainable structures in the neighborhood, community, provincial, territorial, and national levels. This illustration is an assessment wheel under Canadian Community as Partner Model, described by Volman et al. 2017. We use this model to assess and help our patients in the community. Within South Parkdale community, there are 8 subsystems separated by broken lines that are inside the circle working together as one. The core is the people or patient who make up the community. The lines of resistance are the community's defense mechanism that protect the people or the patient from stressors or risk factors. These lines of resistance are the strengths and assets in the neighborhood, as it states that the stronger the capacities and assets of the community and its people, the more resilient the community and its population are, which include internal and external connections with people, different associations, government and non-government organizations, faith institutions, or social agencies. With this instance, the actual assets and strengths that would help our patient and the whole South Parkdale community are government leaders for community initiatives and legislations headed by City Mayor John Tory, Ward 4 Councilor Gord Perks, and Ward 10 Councilor Joe Pressy and offices. Telecommunications company like Rogers and Telus Mobility, private and public schools, transportations, mental, rehabilitation, and medical clinics like Dental House.ca, Center for Addiction and Mental Health, Toronto Rehabical Center, Recreation Center like Mosari Cowan Community Recreation Center, Toronto Police Services, employment opportunities like Trade Pro Academy and Job Starts. Shelters and churches are also included, though those are usually served under Flexible Line of Defense FLD. The broken line surrounding the community is the Flexible Line of Defense FLD that serves as the buffer zone, which helps the community for a temporary relief to the stressors threatening the community or affecting the people themselves. It is the community's resilience to the challenges. With the case scenario, churches like Parkdale United Church of Canada, St. John's Parish National Catholic Church, Epiphany and St. Mark Parkdale Anglican Church, food banks like Parkdale Community Food Bank, and community shelters like Parkdale Community Recreation Center, which are his temporary outlet in survival for his current situation until a permanent solution is done. The inner broken line represents the population normal line of defense, POP and LD, illustrates the complete health status of the people or patients, including the social demographics data, values and beliefs, population health indicators, like for the case scenario, he is 26 years old, seeking help for an ulcer of his foot injection site, struggling for addiction and homelessness, while the outer solid line represents the totality of communities' normal health status or normal line of defense, COM, and LD. On the other hand, the internal and external stressors that contribute to the current patient conditions are income and social protection, unemployment and job insecurity, food insecurity, housing, basic amenities and environment, access to affordable health services of decent quality, financial barriers, problem being eligible for health insurance, lack of knowledge about where to get treated, lack of access to private transportation and high fare value on transit, inability to buy medicine and get nutritious food, cold weather condition, pandemic restrictions, and air quality which is moderately polluted. In a nutshell, our group of community health nurses could use this assessment data for our patients and the whole community of South Parkville to achieve a quality of life and well-being.
Analysis, diagnosis, and planning. Analysis. Once a profile of the community has been developed, the information is examined to find trends and patterns that denote community capacity and any issues the people identify as concern or stresses. During this phase of CCAP process, the factors that underpin the strength of the community are examined so they can be maintained and fostered. The concerns are also examined to determine what the root causes are in order to generate solution. To be relevant, acceptable, and successful, the process of analysis must include the people just as the assessment process embraced community participation. Keeping him in mind, all this process was carried out. Hence, we have results on how much and where to focus for his nursing care plan. Diagnosis. The community health diagnosis is the result of analysis by the community health team. It is the collaborative determination of the issue of priority that gives direction to both goal setting and intervention planning. The goals are derived from the impact of stresses and are aimed to reduce community encounters with the stressor or to limit the effect of stressor through prevention activities that strengthen the community's normal line of defense and flexible line of defense. Planning processes are built on an understanding of how people make choices so that planning is theory driven and based on evidence of best practices in the health promotion intervention. His diagnosis was done as per this model and it was found that he might be depressed due to homelessness and loneliness. Planning the term community health diagnosis is preferred over a discipline-oriented diagnosis for three reasons. It is holistic and does not imply that only a member of a particular discipline can address the identified problem. It underscores that the work in the community by nature inter and multidisciplinary, not only confined to the health profession but incorporating many others, and it places the emphasis on once again on the community, which is focus of our practices for the purpose of the planning nursing intervention. However, do use a different stages of prevention and care were planned for him and implemented.
The nursing interventions that we have. Number 1, primordial prevention. This is to assist and support the patient to seek the cause of his stress, risk factors, and threats to his health. Number 2, primary prevention. Under primary prevention, we have number 1, health promotion and education. Support employment and job training opportunities that assist him to obtain jobs with livable wages and benefits. Advocate him through housing coalitions and legislative efforts to promote affordable housing, employment opportunities, and better access to healthcare. Develop a culturally sensitive health education programs for him to promote healthy coping, communication, and relationship building, mental health, injury, and illness prevention. Promote programs that offer counseling and support for him to prevent continued high-risk behavior such as a result of untreated addiction. Number 2 is health protection. This is to counsel him on proper nutrition, exercise, and basic hygiene to promote healthful lifestyles and prevent disease transmission. Number 3 is secondary prevention. This is to develop programs for health screening and early diagnosis and treatment in the community that are culturally sensitive and accessible for the homeless like him. The last one is tertiary prevention. This is to provide case management of chronic health conditions. Advocate for expansion of counseling, rehabilitative services, and addiction treatment programs for him. Advocate for supportive and transitional housing to enable to successfully transition him back into the community.
Upon implementation of the nursing care plan, follow the evaluation. Keeping in mind this scenario, we will need to focus on following outcomes. He should be able to identify the variables causing difficulties to him. He should be able to identify, tackle, and solve those situations in order to get rid of his drug dependencies. Should be able to take counseling in constructive way and work towards his own betterment. Should be able to secure a job and get through the housing difficulties while transitioning for the facilities to own home. Should be able to develop some good support systems and relationships within the community. Should be able to maintain his health to optimum and for a health routine in his life. Conclusion. We would like to say that community support and family and peer support play a very big part in the life of a person if they are given proper care according to the nursing care plan made, keeping in mind the four bases of community and its elements. There can be various instances where we can salvage the person and give them or help them lead a better life. We can help them reduce and overcome the stressful variables and focus on the positivity of their lives.